Good, happy Monday morning, March 23rd, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Monday morning, so let's begin. First up, 13 new cases of COVID-19 confirmed in New Hampshire. Cases identified in several counties. The New Hampshire Department of Health and Human Services has announced 13 new positive test results for COVID-19. According to DHHS, the new cases are all adults, 9 men and 4 women. The cases raised in several counties across the case. There were 3 cases in Rockingham County, 3 in Hillsborough County, excluding Manchester and Nashua, 2 in Stratford County, and 1 case each in Grafton, Belknap, and Carroll and Sullivan counties. 1 case was found in Manchester. This is the first positive case of COVID-19 identified in Sullivan County. DHHS updated the county of residents for a case announced March 20th. The case had previously been reported to reside in Coos County, but now known to have resided in Grafton County. According to health officials, 8 of the new cases have either traveled domestically or to international locations and had close contact with a person confirmed with COVID-19 diagnoses. 5 of the cases have no identified risk factors. 9 of the new cases are isolating at home. 2 of the new cases are currently hospitalized, and 1 case that had previously been hospitalized was released, according to DHHS. Now let's take a look at this diagram of COVID-19 in New Hampshire. 78 number of people in New Hampshire who have tested positive for COVID-19. 335,403 number of people worldwide who have tested positive for COVID-19. 6 number of people hospitalized with COVID-19 in New Hampshire. 414 number of deaths from COVID-19 in the United States. 14,611 number of deaths from COVID-19 worldwide. There are 15 in Grafton, 6 in Carroll, 4 in Belknap, 4 in Merrimack, 3 in Stratford, 28 in Rockingham, 16 in Hillsborough, 1 in Cheshire, and 1 in Sullivan. The common symptoms: fever, cough, and difficult breathing, how it spreads, and prevention tips. Fifth, 5 deaths in Massachusetts abrupted to coronavirus. Cases surpass 600 statewide. Remote learning for Granite State students begins today. Manchester switched Thursday. Let's take a listen to that video from WR News 9.
Tomorrow marks the first official day of remote learning in New Hampshire. Students will learn from home while teachers will use Google Classroom and other applications to share assignments and homework.
We're doing the best we can under the circumstances.
During a telephone interview with News 9, Nashua's Superintendent Jamal Mosley says his team is ready to go.
Many of our teachers have had online platforms established, so they're just continuing on what they've already been doing before. Some of our teachers have viewed a combination of online and in-class support and instruction, so now they've completely switched to that online piece.
Manchester and many other cities and towns launched their remote learning last week.
Our goal was to have remote learning up by Friday. We were able to get to it by Thursday. So we really appreciate the work of all of our team, our administrative teams, our teachers, our support staff. They've done an outstanding job.
I've been really impressed with how everyone has stepped up.
Education Commissioner Frank Edelblut says this transition is a life lesson for everyone.
When we think about education, we think about students and learning. But in this case, students are learning, but parents are learning, teachers are learning, administrators are learning, and state officials are learning.
As far as when normal classes will resume,
right now it looks like it will probably be extended, and I think schools should anticipate that it will be extended. Parents should anticipate that that will be extended, but we will look at that more closely as we get closer in.
And now the commissioner and other superintendents are really urging parents to have some sort of routine over the next 2 weeks. That can include waking your child up in the morning as you would for a normal day, having lunch or recess breaks. They say this will really provide some normalcy in their lives during this very unusual time. We're live here in Nashua tonight. I'm Tim Callery, WMUR News 9.
Okay, and there you go on that video and that report. Neighbors in Bedford draw positive messages in chalk during social distancing. Positive approach during COVID-19 outbreak. Let's take a listen to that video from WMUR News 9.
Hi, I'm Sherry Allen, proud owner of Mercedes-Benz of Portsmouth. We put every effort into making Mercedes-Benz of Portsmouth your Seacoast Mercedes-Benz dealer. We look forward to meeting you at the all-new Mercedes-Benz of Portsmouth. And remember, where you buy is just as important as what you buy.
All right, neighbors in Bedford taking a bit more positive approach to the government's request to stay home. Check this out. They are going around and writing messages to each other in chalk. They're writing those messages in each other's driveways and on street corners. Started a few days ago, and since then, more and more people have joined in.
It's a lot of fun. The kids are loving it, and some positive messages while we keep our space from each other.
Told the idea came from a woman who owns a Manchester area yoga studio, and next week, a different neighbor is offering to take family photos for free.
Okay, and there you go on that video and that report. Very nice there. Keep positive during this COVID-19 outbreak. Manchester VA announces new screening practices to limit the spread of COVID-19. Guests under 18 banned. Let's take a listen to that video from WMUR News 9.
Hi, I'm Sherry Allen, proud owner of Mercedes-Benz of Portsmouth. We put every effort into making Mercedes-Benz of Portsmouth.
Thanks. The Manchester VA Medical Center announced today it will screen all veterans in their vehicles prior to entering the building. Visitors to outpatient clinics will be screened at the entrance. These are additional measures being taken to prevent the spread of the virus. Earlier this month, the VA announced it would limit visitors, banning guests under the age of 18.
Okay, and there you go on that video and that report. New Hampshire businesses struggling with economic impact of COVID-19. services, salons, all impacted. Let's take a listen to that video from WMUR News 9.
I see the difference that our focus on professional development has made in the lives of young people every day.
It hasn't even been a week since Governor Sununu ordered restaurants to switch over to takeout only. But already owners and their employees are feeling the financial hit. It's Sunday morning at Manchester's airport diner, and it's so quiet, it's almost creepy. The single waitress answers the phone.
Did you want home fries or beans?
Writing up the only order received in 20 minutes. The lone chef gets to work, but the counter behind him and dozens of tables, all empty. The picture in the parking lot similar at other Common Man properties, where owner Alex Ray says business has been down as much as 80% over the past week.
Roughly at this slow time of year, we have about 900 employees. We've let 700, I hate to say let go, on furlough.
I think most of us in this industry are kind of just trying to get by on humor.
Tiffany Ramos is a server at 3 area restaurants. She says while a few of her coworkers are getting hours doing carry-out, she's not getting any. What's your status at all 3 right now?
Laid off, and laid off.
It comes at the end of week 1 of Governor Sununu's 3-week order banning restaurants from allowing people to dine in, an effort to stop the spread of COVID-19. Hair salons were not ordered to close, but the owner of Lux Salon and Spa in Bedford chose to do so anyway, saying it was the right thing to do.
There's no getting around that we're touching people.
But even with 20 employees cut and no income, Joellen Cowett wants to help. She's collecting items later this week, like headbands, to help protect the foreheads of first responders reusing face shields. She's even willing to pay.
I will pay $5 for every mask and every headband that you bring to me on Wednesday.
Coming together to help in a time when so much remains unknown.
We're only 2 years old, and I worry every day, are we going to be back here?
The order to continue takeout only lasts through April 6th. The governor says that the state will then reassess the situation at that point. Reporting in Merrimack, Tyler Dumont, WMUR News 9.
Okay, and there you go on that video and that report. Dow futures dropped 600 points briefly, hit limit down, halt as investors await a simultaneous deal. U.S. stock futures plummeted again early Monday morning as Wall Street awaits on Washington to agree to an economic stimulus and resource plan to cushion blow from the coronavirus outbreak. Hospitals report 50% surge in coronavirus patients. Let's take a listen to that video from ABC News.
Hospitals making emergency demands, some doctors and nurses running low on protective gear, many reusing their masks, some hospitals reporting a 50% surge in coronavirus patients. Here's ABC's Adrian Banker.
Tonight, a massive rush to get tested suddenly cut short. Hundreds of people arriving before 4:30 this morning, waiting in a mile-long line at New Jersey's biggest drive-through testing site. But just 30 minutes after opening, they hit capacity, and police had to turn people away. Medical professionals now advise that only those with severe cases seek medical help. Inside hospitals tonight, there's growing concern.
It's a scary time to be a doctor in America, and especially in New York.
Dr. Cornelia Griggs, a mother of 2, is a pediatric surgeon who works with coronavirus patients at Columbia University Medical Center. She says she's worried the hospital could run out of masks, eye protection, and gloves. Her message on Twitter: "Don't make us orphan our 2 toddlers."
It's forcing me to feel like I have to live apart from my children in order to protect them, and that breaks my heart.
Internal memos written by Columbia University's chief surgeon, Dr. Craig Smith, say that his hospitals have seen a 50% increase in coronavirus patients, burning through 40,000 masks every day, adding that officials predict the number of cases might not even peak for another 32 days. Two New York area medical professionals we spoke to tonight are worried about what lies ahead.
We're filling up our ICUs. We have several floors now that are devoted only to COVID-positive patients.
There's a misconception out there that this is a disease that only affects the elderly and only affects people who have significant medical problems, and that's not what we're seeing in the hospitals around New York. We're seeing younger people.
Many doctors tell ABC News over the past few weeks they're being forced to reuse masks and protective gear. But even with the stories of nationwide shortages of N95 masks and other gear, Mount Sinai Hospital in New York City says it has sufficient supplies and is prepared for things to get worse.
On the whole, I would say I'm feeling inspired, just being able to watch the stuff that my colleagues are doing. It's absolutely incredible, I think what people have done over the last month.
Tonight, researchers at Columbia University estimate the number of undetected cases is 11 times higher than what's officially been reported and predict that 650,000 people could be infected over the next 2 months, even if the transmission rate is cut in half. Attorney Manny Alejandro tried to get tested at this urgent care center in Brooklyn, instead finding this sign posted that said no more COVID-19 tests. 49-year-old Dr. Jean-Luc Neptune tested positive for COVID-19 6 days ago, cautioning that this disease be taken seriously.
Joint pain, myalgias, muscle pain, have had that as well. I literally had a fever for 10 days, some days more than 101, which is very uncomfortable.
Detailing those symptoms, we could hear the cough right there. Adrian Banker joins us. And Adrian, we just learned that FEMA will be setting up new medical stations in the 3 states that have the most coronavirus cases right now.
Yes, that's right, Tom. The president making a major announcement. He says that FEMA will set up those makeshift hospitals in California, New York, and Washington state, providing thousands of new hospital beds. Tom.
Hi. Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another newscast. And I'll have a news report coming up in a little bit. Goodbye, everyone.